Okay, I'm Savannah. This is my head-to-toe assessment video. I've closed the door as I'm coming in to provide privacy. I've washed my hands, and now I'm going to introduce myself. I'm Savannah. I'm the nursing student taking care of you today. I'm going to do a quick head-to-toe assessment, just assessing your bodily functions, your bodily systems. If you'll state your name and date of birth for me.
I'm Joey Davis. I was born July 2nd, 2001.
Okay. I would wash my hands, and then I'm going to first assess his vital signs. I'm going to start with the temperature. It should be between 97 and 99 degrees. I'm going to go into taking his blood pressure. The systolic should be between 90 to 140. The diastolic should be between 60 and 90 for normal sounds. I'm going to assess his pulse, which should be between 60 and 100 for the rate. The rhythm should be normal, and the amplitude should be +2. I'm then immediately going to go into taking his respirations. His respirations should be anywhere between 12 and 20. They should have a normal rhythm, and they should it should be a normal depth, so not too shallow and not too deep. I'm then going to take his pulse oximetry. His oxygen saturation should be between 95 and 100. Okay. And are you in any pain?
No.
Okay. For the pain assessment, if he was in any pain, I would I would assess location, duration, characteristics, severity, any relieving factors, and radiation. Then going into his mental status, coming in, he reacted spontaneously to me walking into the room. He's alert and he's awake. Testing his level of consciousness or orientation. I know he knows his name, so I know he knows person. Where are you?
I'm in your room.
Okay. What day is it?
November 29th.
Okay, and what's the situation?
Oh, you're doing your head-to-toe assessment for nursing school.
So I would say he is alert and oriented ×4. Before I start my assessment, going throughout my assessment, I would be testing his skin, palpating and inspecting as I go along, looking for any lesions, color, temperature, moisture, and edema. And we're going to start at his head. Do you have any visual deficits?
No.
Okay, and your hearing?
No, my hearing's good.
Okay. No problems for either?
No.
Okay. I'm going to go straight into testing cranial nerve number 3, 4, and 6. 3 being the oculomotor, 4 being the trochlear, and 6 being the abducens. So we're going to test this by, this way. If you'll keep your head still for me, you're going to watch this pen with your eyes. Okay. Okay, and then keep watching. Here I'm just making sure everything moves equally and symmetrically. I'm then going to test continuing with cranial nerve number 3, the oculomotor. I'm going to test his pupils. While I'm testing them, I'm looking for that his pupils are equal, round, and reactive to light and accommodation. Okay. I'm then going to go down to test the patency of his nares. So I'm going to occlude this right nostril, if you breathe out for me. Okay, and then let's occlude this nostril. Okay, sounds clear. Any issues?
No issues.
Okay. I'm then going to move down to cranial nerve number 9 and 10, 9 being the glossopharyngeal. So if you'll stick your tongue out for me. So it's midline and symmetrical, and then I'm going to have you open your mouth so I can inspect. I'm inspecting the color and moisture, and then if you'll say ah. And I want to make sure his palate moves symmetrically. Then I would test cranial nerve number 10, the vagus nerve, for a gag reflex. Moving down to the neck. First, his head had no issues in terms of skin assessment, no lesions. Moving down to his neck, I'm going to look for any jugular vein distension, ideally at a 45-degree angle, which is normal. I'm going to test your spinal accessory nerve number 11. If you will raise your shoulders against resistance. Okay, and then if you'll turn your head against resistance. Okay, other side. Okay. I'm then going to go in to palpate his carotid arteries. Okay. I'm just palpating for the rate and rhythm or any abnormalities, which he's normal. Moving on down to his upper extremities, I'm going to start by testing range of motion. So if you'll roll your shoulders for me. Okay, and then if you'll bring your elbows down, and if you could roll your wrists. Okay, and then I'm going to assess capillary refill, which I would do for each finger, ensuring capillary refill is under 2 seconds, 2 seconds or less. Okay, and then if you will turn your arms up for me, I'm going to make sure, I'm going to test both your radial pulses for rate, rhythm, and amplitude. And I'm going to do it equally to make sure everything's symmetric. Okay, you're looking good. And then I'm going to move down to your chest. First, I'm going to inspect for any asymmetry. The width should be twice the depth. And I'm going to go straight into listening to his lung sounds, listening to all 5 lobes. Okay. Okay. We're going to start here. And then I'm going to come here. And I'm testing for symmetry or listening for any adventitious sounds. I'm going to go straight down to here, actually. Okay. And then over here. Okay. And then if you'll lift this arm up for me. To the side. Okay. And then if you'll lift this one up for me. Take deep breaths. Okay. And then I'm going to have you kind of sit forward here. Let's see, I'm going to kind of turn you a little bit. I'm going to listen to 4 more on his back. If you'll continue to take deep breaths. There, 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 and here. Okay. I'll be looking for any adventitious sounds, such as wheezes, crackles, stridor, rails, or bronchi. I'm then going to go into listening to his heart sounds. First, I'm going to palpate the point of maximal impulse, which is the mitral. I'm going to come here, and I'm just going to palpate for rhythm and rate. And then I'm going to go straight into auscultating his heart. I'm going to start at the aortic valve. S2 should be louder than S1. Okay, and then I'm going to come straight to the pulmonic. S2 should still be louder than S1. Coming down to Erb's point. S1 and S2 sounds should be equal. And then coming down to the tricuspid, S1 should be louder than S2. And then same for the mitral valve. Listening for any abnormal sounds or rate or extra heart sounds. You're normal. Going straight down into the abdomen. First, I'm going to inspect for symmetry. When was your last bowel movement?
This morning.
Do you have any issues with incontinence or urinary retention?
No issues.
Okay. And I'm going to auscultate his bowel sounds. I'm going to start in the right upper quadrant, listening to each for a minute. If I heard absent sounds, I would listen to each for 5 minutes. And then I'm going to go to your left upper quadrant, and then left lower quadrant, and then right lower quadrant. Listening for any either no bowel sounds or hypo or hyperactive bowel sounds. Then also palpate for any lumps or abnormalities, and I'd be assessing his skin for lesions, temperature, color, moisture, edema. Going down to your lower extremities, let's start with I'll have you against resistance if you'll lift your legs with your toes. There we go. Yeah. Okay, and then if you'll stand up for me, we're going to do some range of motion. If you will, you're going to bring your leg up, okay, and then back. And then if you'll roll your ankle for me. And then we're going to do the same thing on the other side. So up, okay, back, and then roll that ankle. Okay, looking good. And then if you'll sit back down, I'm going to test sensation. So if you'll close your eyes for me, if you'll tell me where I'm palpating.
The upper thigh, the inner calf.
Okay. After that, I'm going to go straight to assessing capillary refill of his feet with no socks or shoes on. I'm assessing capillary refill for, it'll refill under 3 seconds. I'm then going to go ahead and take his dorsalis pedis pulse about, or I'll use this one actually, 2/3 up the foot. Looking for an even rate and rhythm, and then I'm going to come back here to the posterior tibialis. Okay. Not noticing any issues. Then I'm going to go ahead and reiterate. I've been assessing his skin as I've gone down, doing a Braden skin assessment. The maximum number is 23. Anything under 18 he would be at risk for pressure ulcers. Yeah.